Rev-Up St. Lucia 95.9 FM presents a program that puts your mental well-being first. Mind Matters. Hosted by Dr. Julius Gilliard, St. Lucia's own psychiatrist, taking you inside the conversations that shape our mental health. From stress, relationships, and parenting to workplace balance, youth challenges, and mental disorders. Every Wednesday from 10 to 11 a.m., Dr. Gilliard brings expert insights, real stories, and practical tools you can use. Tune in for Mind Matters on Rev-Up St. Lucia, because at Rev-Up 95.9 FM, your mind matters.
It's now time for another Mind Matters, hosted by Dr. Julius Gilliard. Dr. Gilliard, it's good to see you again.
Good morning, Andre, and good to be here.
All right,
welcome,
good to have you.
And today, well, for the past 5 weeks, we've been dealing with different mental health issues. And the purpose of this program was to educate. And I want to get back on track to educating the public about mental health. Today, what we're going to be speaking about is more or less a historical overview of mental health systems in the Caribbean. And here in St. Lucia, and even across the Caribbean, we're beginning to realize something very powerful, and that is that the way we understand mental health cannot simply be copied to the Western world or to the European world. And our history, our culture, our family structures, and even our colonial past all shape how we experience mental health. Very important, how we experience mental health and mental illness. I remember in the 70s and 80s, there was a lot of hubbub about Caribbean people having so much mental illness when they migrated to the UK. And what happened was there was a Jamaican psychiatrist, Frederick Hickling, who actually reviewed that data. And what he found was that the Europeans had a different way of looking at the symptoms that Caribbean people presented with. And so everybody was diagnosed with schizophrenia. And there was a huge difference in the rates that he found when he, as a Caribbean psychiatrist, spoke to those people or reviewed the symptoms that they presented. We realized that a lot of the things were things that we find normal here, like spirituality and relationship with God and so on. So our experience of mental illness and mental health is very different to the experiences of persons in the rich countries, you could call them. So what we have found over the years is that our mental health treatment needs to be adapted to that. So we cannot just take the European diagnostic systems and apply it blindly to our population. That would be unfair to the persons who are seeking care. And so there's been a lot of work around that. So what I want to speak about today is basically the historical underpinnings of our mental health systems. Our mental health system, or our mental health progress, has been molded by slavery, molded by migration, molded by our willingness or our ability to survive the different things that have happened in the Caribbean, the different hurricanes and other disasters that have taken place. And what we need to do is to build a system rooted in our own identity, one that heals collective trauma, because there's a lot of trauma in the Caribbean. A lot of persons who, when I see them, they fill out the forms, and a lot of them have multiple adverse childhood experiences, and in their mind all of these things are normal for them. I mean, they're not normal because human beings are not supposed to go through those things, but to those persons they're normal. So we have to take all of that into account when we're addressing things today. We have to take things from the past and tie them into what we see in front of us. So today what we want to ask is, what does mental health look like in St. Lucia today, and how we got here, and what's working and what really needs to change. Now, to understand that, we need to look at where we came from. And during colonial times, mental illness in the Caribbean was treated as something to be hidden away. I think I mentioned it at our last sitting. Across the region, people were considered mad when and when they were locked up. So they were thrown into asylums. Some were even shipped overseas for confinement, and care was custodial and not compassionate. So it was basically to get those undesirable elements from off the streets. And St. Lucia mental health care began in the colonial hospital system in the same way, with little understanding of psychological well-being. I'm sure a lot of persons can remember in the 70s, there was a doctor who was accused of always shocking people.
I remember.
And so on. So community support was replaced by isolation in the Caribbean. But as we moved into independence, what we saw is...
And by the way, did that really happen?
I cannot tell you, I wasn't there. But a lot of the patients do say that they were being shocked. But a lot
I remember
of them
hearing that.
Actually did, because at the time shock treatment was a big thing in psychiatry. The same way before that, lobotomies were a big thing in psychiatry, where somebody with a severe mental illness, they would take off a piece of their brain, and it would leave them very, very docile. Yeah, so shock treatment was a lot of barbaric things used to happen, because persons didn't understand what was happening. I mean, we still have a very small understanding of what's happening, but the treatment is a lot more compassionate now. That's the difference.
Yes, that is true.
Yeah, but
were you around when we had the Golden Hope?
I was around, but I wasn't in psychiatry as yet. I started just the same year that we moved to the wellness center.
Because as a young man, I was curious to see what it was all about.
Yeah, I've been in there already.
Well, I didn't go in. I was outside, and you could, in fact, for those who have no recollection of what happened back then, they were like almost like on parade. All right, it was a building. The building is, well, it's not really there anymore. Is it there?
And it was similar to the old jail, so
right,
it actually
exactly.
looked like a jail.
So you go, you see them, they all packed up like sardines in there, whole bunch of people, and you could see them. I was like, they were just on parade. Yeah. I remember it was sort of traumatic, actually. I'm seeing them that way, and I've never forgotten the images.
Yeah. So imagine you experiencing that, and then you developing symptoms of mental illness, and being told that is where you are going to be taken. You can imagine the terror.
Yes.
And that in itself is a traumatic experience.
And I don't think they could have just left. They couldn't have done that, right? Yeah, because the place was locked.
Yeah. You had persons who escaped, but they were brought back by the police if they were found.
But I just remember there were quite a few individuals who were being kept in there.
Yeah. I must say, from when I visited there, it was a very traumatizing atmosphere. I don't think anybody who would go there would do well.
Does your research indicate what happened, what caused the shift in outlook and the decision to...
Yeah, well, the world changes, and as the world changes, there has been a lot more research into mental health and the mental health treatment. Even with the advent of the human rights system and human rights movement, I think that's when an even more significant change occurred. So a lot of countries started to look into not custodial psychiatry, but rather community psychiatry. And that took a little while to catch on here, but it has caught on, and it is being developed at the present moment.
And we have to say bravo to whoever the leaders were at that time, because it's not an easy thing to change your mind. Some people feel a way about something and they don't shift.
Yeah.
So we have to say bravo to those people who were around and saw the light. Yeah.
I mean, there's still resistance to it, because family members who do have the experience of a family member with severe mental illness, it's not easy for them to deal with. And a lot of persons would still approach the mental wellness center to ask for custodial care of their relative, and that in itself is not possible at the moment, because there's a tremendous shift to community psychiatry. The thing with community psychiatry is that it's not as simple as persons believe. So it's not that you have a nurse or a doctor in the community and you give people medication, because most of those persons don't want to use the medications. And most of those persons have other issues going on, like substance abuse, or they may be homeless, or the family may reject them and they don't want them around. So it's not as easy as it seems. I know in places like Montserrat, And even Jamaica or Trinidad, you have homes where the persons are housed and they can come and go as they please. And one of the things about those homes is that they take medication. So those who are capable are given the medication and they take it, and those who are not capable, they have somebody to ensure that they take the medication on a daily basis and to attend the clinic follow-ups, etc. But I'm not sure how close we are to this. But as far as I know, we're not. I don't know of any structure that's been put in place for that. I know the ministry is now making developments in the community psychiatry aspect of it, and that we now have a psychiatrist in charge of the community who's based at the ministry. So I can't tell you. Maybe in one of the future programs I can have somebody from the ministry come on so we can have a chat about that, about the policy and the direction for community mental health in St. Lucia.
Mm-hmm.
Yeah, but over the years, there's been a lot of mistrust about psychiatry in the Caribbean, and that, I guess, comes from stories like yours, where persons visit the custodial establishments and see the horror of the way that persons are being housed, and ours is nothing nothing horrific yet. I mean, I've seen videos and pictures of places in South America, for example, where it's a lot worse than Golden Hope used to be, a lot worse.
Mm-hmm.
And so it was just a sad situation in the past where you have somebody developing a mental illness and being put in a place where in some cases there were no trained staff. So they were treated like animals, basically.
I'm talking about that. I remember reading recently in Jamaica.
Mm-hmm.
I don't know, I think maybe that probably happened there as well. But there were people who had mental issues,
Mm-hmm.
and they did a serious crime, like, for example, murder,
Mm-hmm.
and they were locked up in a prison in Jamaica. I think there were a few of them, a few incidents. And in one case, I think a gentleman was in prison with a mental issue for close to or over 40 years.
Mm-hmm.
And they just basically forgot the gentleman in there. Yeah. Until I think Indicom did some research and found out that the gentleman had been there languishing. And when they found him, he was in a mess, a complete mess. Yeah, because the system is not designed to take care of people with those issues.
Even recently, we had issues like that here, where the government was actually sued by a few persons, and I think that's when the strides really started to be taken, because they now realize that, hey, this is real, and persons are actually taking notice of this happening, and so we need to do something about it. But there's still a lot to be done. Yeah. So if we have to look at St. Lucia, there have not been many many recent assessments done of the mental health system. I know the last something called a WHO AIMS report, and that was done in 2007, but it was compiled in 2010. So we have made some important strides since then. We now have community mental health nurses. We now have district level services and a functioning the mental wellness center, the psychiatric hospital. So the Ministry of Health has a national mental health policy. I don't know if it's an official policy, because as far as I know, the last policy that was done was in 2012 or 2010, around then, but it was still in draft as at my last viewing. So efforts are being made to integrate mental health into primary care. I mean, there's a lot of resistance to that because of a lot of the primary care staff claim that they're not trained.
Explain. You said
so. Primary care is the health centers, even the general hospitals. So having persons trained enough to say, hey, this person is depressed or suicidal. How can I care for this person before I refer them to a specialist? Or somebody coming in with behaviors that are disruptive in the community. How can I care for this person before I refer to a specialist? And that there's an ongoing effort to incorporate that kind of care into the primary healthcare system. But there's staffing limitations. You have facilities where there's a lot of overcrowding on a daily basis in clinics, and not enough funding. So one of our biggest factors is the stigma that we spoke about last week. And too often people still just talk behind closed doors about mental illness and not talking openly about it. I mean, I would love to have had 2-3 persons come on this show every week to speak about their mental health challenges, but nobody wants to speak about it as openly as it needs to be done.
You mean people with the mental health
with mental health challenges?
Yeah? Okay.
Yes.
So they're reluctant.
Yeah, they are. They are, because I guess the stigma. Nobody wants to be seen on the streets and jeered at or spoken to in a derogatory manner.
But considering the fear that people still feel towards people with those mental health issues, right? Why would they still want to jeer those people?
Yeah, so
considering the fear, right? Because there's some fear.
Yeah, well, the fear,
apprehension.
The fear is unfounded, and I think the fear is about what they don't know.
So why do they still want to jeer those people? Why do they want to give them a rough time?
Well, I don't know what to respond to that, Andre. It always has baffled me because, in my opinion, it's something to feel curious about. So you see somebody behaving in a different manner. What can be going on with that person? That's the way my mind works. What can be going on with this person, and is this person dangerous? Has this person been dangerous in the past? And most of the times, no. And like I said last week, most of the times, those persons are the ones who are victims of violence, and they very unlikely propagate violence. So, yeah. So what we have to keep in mind is that our systems are different, and one of the things that's positive about our system is the spiritual aspect. So I think that's something that's really neglected in our environment. I remember there was a case that I sat on as an expert in Florida, where a St. Lucian gentleman woke up in the middle of the night and thought he saw a demon in his house and lashed out. And in his mind, he knocked out the demon or killed it or whatever. And apparently is a friend of his who was there in the night. He thought she had left, but she came back. And when he woke up, he saw the demon, lashed out, and she died. So the courts there are totally oblivious to our sense of spirituality and so on, and how that can affect stuff like hallucinations and so on when we wake up. Because a lot of like the cockma and so on, a lot of the times persons, in the science, things like cockma don't last for more than a few seconds. What may happen in our environment is that because of our spiritual beliefs and the fear around that, those hallucinations can be prolonged. I don't know that there's much research around that, because stuff like spirituality, you can't really research it because you don't have any objective markers. Yeah, so all you can make is conjecture. So those things are difficult for persons in the science community to really put their hands around. So first of all, you have a mental health issue which is difficult to quantify, and then you have the spiritual aspect which is even more difficult to quantify. And so a lot of the times that aspect of our culture is neglected. And is one of the reasons I said at one point, when persons come to me and tell me that they want to take their relative to a healer and so on, I never resist, because it's something that can help. Some persons it does help. In fact, in a lot of cases it does help. You have persons who I have treated in the past, and the treatment, yes, may have worked to a certain degree, but with the intervention of a healer or somebody else, you do have more, in some cases, more improvement, and then the person may even not need the medications after that. So our culture is very important in the treatment of mental health disorders, and even Paba, I'm sure if we have him on the show, he can attest to that. I know that, what's his name, Father, the one at VG, the one who wrote the book on the, what's his name again, St. Rose, Father St. Rose, has a couple of books on the spirituality and so on in St. Lucia, and those are gentlemen who actually take their spiritual practices very seriously, and they have lots of stories about healing persons with mental distress with their spiritual practices. So it's something that we need to look into more. We need to maybe see if we can do some more research as to how many persons out of how many hundreds have benefited from it. And because as long as you have a significant, what we call a clinical significant improvement, then it shows that the treatment works. I think there's an over-reliance on drugs in psychiatry. I think a lot of persons who actually go to a psychiatrist or go to a doctor just want to be heard. Yeah, and actually there's research into that. Most doctors who sit with a patient, after 18 seconds, they're already intervening into what the person is saying. They're already interrupting the person.
Mm-hmm.
So then they never really listen to what the people are telling them. And in our culture, that's the role of the spiritual person, to sit and listen and to see if there's a deeper cause to the person's pain and challenges.
So if I understand you correctly, I'm Dr. Gilead. You're saying you're not averse to anybody using some other method,
No.
if as long as it works.
Yeah? Exactly.
Mm.
So the aim of medicine is to heal, to do no harm, and to ensure that the person gets back to a level of functioning where they can be productive in society. And that brings me to another point about mental illness and mental health challenges, that we use in medicine something called disability-adjusted life years to understand the burden of mental health disorders. And if we have to look at that in our St. Lucian sense, our St. Lucian society, what that means is that persons with mental health illnesses, especially severe mental illnesses, tend to die younger. So they've lost a significant number of years that it could have been beneficial to the society. And even those persons have a lot of disability because of the illness. So they may not be able to work all the time, have frequent breaks from work, may not be able to be in the job that they would have preferred. And so the life years due to disability is significant. I think more significant than most other illnesses that persons experience. So that is an important thing, and I think it's something that should be given national priority, because if we can reduce those, then we can have a society that's a lot more productive and more flourishing than we do right now. So people tend to be resistant to investing into mental health, but they're not aware that mental illnesses do have a significant, I think it's like 18% of disability adjusted life years. That, imagine that being put into the society. That is significant. Yeah. So I was speaking earlier about the WHO AIMS report, and what it tells us is that we face a lot of challenges in St. Lucia, and that there's an increasing rate of depression and anxiety. And now that was 2012 or 2010. Since then, around the world, there's been an even greater increase in the rates of depression and anxiety, which a lot of authors blame on the smartphone, the rise of the smartphone. So I think more research needs to be done around that. And we do have a lot more alcohol use, a lot more other substance use in St. Lucia especially. And when it comes even to suicide, the fact is that men die by suicide at a greater rate than women do. Women attempt more, but men die more.
Just stick up in there, Dr. Gilead. Let's just go back to what you said about the use of the cell phone and its connection to mental health issues, especially depression, etc., etc. And also, I think right now a lot of countries are introducing laws that limit children's use of the cell phone and this sort of thing, smartphone and so on. So just explain to us, Dr. Gilead, how does using a cell phone affect your mental health? Why does using a cell phone cause people to get depressed? I don't understand. Please help me.
Well, two things you have to look at. Number one, with a cell phone, we connected 24/7 to the internet. And with the internet, you have access to all kinds of information. So people believe information is king, and the more information you have, the better. But no, you have certain persons who are vulnerable. For example, girls. Girls are very vulnerable to comparison, to social comparison. And if you have a little girl who is always on the phone and only seeing pictures of slim girls or pretty, in inverted commas, girls, or girls with certain characteristics who are popular, and they are different to those girls. For example, you may have a dark-skinned girl who's all she's seeing is images of fair-skinned, white, slim girls with in their minds perfect bodies, and the image that they have of themselves becomes distorted. Yeah, and that in itself is a significant trigger for depressive episodes, because if that child goes into the school and sees other children like them, or unlike them, or like the images that they see on the internet, then they start to compare themselves even more and feel like they don't fit in. And if their peer groups start to reject them or bully them, then there's even a worsening of that. On the side of the boys, it is the social disconnection that takes place, because when you were a boy, who you played with? All the other boys in the neighborhood, right?
Yeah.
Right. So what you see now is boys locked up in their rooms, on their devices, most of the day or night, and not having the person-to-person interactions. What we call the communal needs, or the community needs, are not being met, and that in itself is a trigger for anxiety, because when they do have to face people, they don't know how to act, they don't know what to say, they feel awkward, and that in itself can be a trigger for anxiety and depression. So the smartphone or the devices that we give our children, we have to be very careful, and a lot of researchers are now saying that no child should be given full access to the internet before the age of 16 or 18, because in that, from before that, the brain is still developing. And I think I also spoke about synaptic pruning at one point. So if the child, all they do is this and scroll and so on, then the paths in the brain, the pathways in the brain that have to do with that are what are developed, and then nothing else is developed. So the child now has no interest in anything else outside of that. And I have actually proof of that, because I have a client of mine who has autism, and outside of her device, she doesn't want to do, see, and when her device is removed from in front of her, the tremendous tantrums that take place, because she needs to have it.
Yeah, I think recently, which Asian country, I think the government was actually brought down because they had blocked
Nepal,
right? They actually blocked access to the internet, so young people came out in droves. They were so angry that they had done that.
Now, if you have to look at the difference in China has a lot of policy around that, so they don't allow children on the internet with unrestricted access to the internet because of all of that. So what has happened is we have been so overprotective of our children. Don't go out into the field, don't go and play, because something might happen to you, but then we're not protecting them online. And that's where a lot of harm takes place.
And that's where we feel comfortable.
Yeah,
they're not out there, they're home, and they're on their device.
And we don't have a clue what's happening on the devices. We don't have a clue, and then one day our child says, I want to kill myself, and everybody is up in arms and wondering why. And it may be stuff that's happening on the internet.
So in terms of the adults now, because when you said depression a while ago, I was assuming that you're referring to adults as well.
Yes.
So what does the science say in terms of how adults are affected or impacted negatively by what we do on a cell phone?
It's the exact same way, Andre. It's just that with the adults it may take a little longer, and not just that, but with the adults who are spending a lot of time on the cell phones, especially if they have children, then they're now neglecting their children. Yeah? And then the more time you remain on the device, the more addicted you become, and then other aspects of your life start to be neglected. So I don't feel motivated to go to work or to do anything at work. I can't finish any tasks. I have difficulty focusing on everything, because every time I hear a buzz, all my self starts to scratch. I get distracted very easily. Yeah? So the adults themselves, the more time they spend on the devices, the more they start to have a lot of other difficulties, and persons come to me with symptoms of ADHD. And when I probe into the amount of time that they spend on social media and other things, it's a lot. and they have a huge difficulty stopping it or reducing it because it's an addiction. And that's what addictions do. Addictions are that you need more of that drug, and you tend to neglect your other responsibilities to attain that drug.
Well,
Yeah.
okay, so let me just give the numbers that you can call if you'd like to comment on Mind Matters. The fixed line is 572-9710, 572-9710, or the WhatsApp platform, it's 287-0971. WhatsApp is 287-0971. So, Dr. Gilead, we have somebody on the WhatsApp platform. So if you don't mind, just take your headphones.
Good morning, caller.
Good morning, Andre. Good morning, Dr. Gilead.
Good morning, sir.
Good morning,
Thanks
sir.
for calling.
Yeah, thanks for accepting my call.
You're welcome.
Okay, I appreciate that. Dr. Gilead, when you talk about mental, referring to the brain,
Yes, we are.
99%. Okay. When someone mostly have suffered from a mental problem, you can say abuse of substance abuse. You can say it's one.
Yeah, it is.
All right. I mean, a broken heart can be one of them.
Yes.
It doesn't have to be a lover. It could be from a family or friend that
Yes.
a broken heart, and then okay. And then you can say even genetic.
Explain.
I mean, if your parents or your parents or family, for the family, this can lead to mental problem too. I mean,
Yeah,
down the line.
it actually can. I'm not
Okay.
sure if you always listen, but I think we spoke about something called epigenetics at one point. What persons don't realize is that when your grandmother was 5 months pregnant with your mother, you were already inside of your mother.
Oh, okay.
Yeah, so anything that would have happened to your grandmother or your mother, it may be encoded in your genes. In fact, all of us. And so a lot of persons experience things that they have no clue where it's coming from. And it could be something that our foreparents went through that we are now experiencing.
I'm saying that to ask you this question. Sometimes you hear somebody suffered a sudden heart attack, okay, and the person passed. Can somebody suffer from a sudden mental breakdown?
Yes.
Be there, enjoying myself, relaxing. I can just suffer from a sudden mental breakdown
Yes, you can.
without thinking about anything.
Yes, you can.
Okay.
So if I were to
Thank you.
go further
I listen on
in,
the radio.
Thank
into
you.
that,
Thank you. You have another call? I'm going to hold your thought
Okay,
while you
no
take the other call.
good morning, caller. Thanks for calling.
Hello.
Hi, sorry. Dr. Gillard and Andre, morning.
Morning.
Good morning.
I'm one of Dr. Gillard's patients.
Oh, welcome.
Okay, welcome.
And
Thanks for calling.
Thank you. And I have been diagnosed with 1, 2, 3, 4, 5 slight mental illnesses. And I say slight because I'm not hallucinating. I don't have what is termed as a severe or severe mental illnesses. However, I was terrified to let people know. And one person in particular, I was terrified of letting them know. And when I did let them know, he said, "Oh, you see, I knew you were crazy." And I thought, what? Okay, remind me not to say anything to you again. And then I listened to you talk about cell phones and the impact it has on mental illness. And I have to say that for me, I have gotten off social media because I find that it is very exhausting and it depletes my soul. So, you have to learn to rework your mind. You have to learn to rework everything. You have to relearn everything in a different way to be able to function now. And even with people who are diagnosed with slight mental illnesses, depression, anxiety, borderline personality disorder, ADHD, CPTSD, PTSD, there's a stigma because at first you start to think, oh my God, how am I going to get through all of this stuff? How am I going to do this? How am I going to do that? Whether you have 1 or 10 or whatever. And it's really weird because now you're having to learn things differently. You're having to have different conversations with yourself. You're having to honor grief. You're having to learn your patterns and other people's patterns, and you start seeing life in a very different world. But for me, I learned a word last week called ego dystonic, and I think that's who I am as well. And of course, I've learned not to make the diagnoses who you are, but know that you live with a diagnosis. You have something, but it is not you. Sometimes I also have difficulty phrasing it. Do I say I have such and such, or I live with such and such, or I experience such and such? So even, you go through it daily, and it's very important to understand that your counseling and your medication is very important. Your support system is very important. The way you speak to yourself is very important. Acknowledging painful truth is very important. Creating distance, even from people you love, people who you think are family and friends, you may need to walk away because you need to heal. You need to reconnect with your support systems, learn new support systems. Find out who you are, what triggered you, what hurt you from your childhood. And a lot of people don't understand when you say, I was abused as a child, or I was beaten as a child, or I was laughed at as a child. And these things have lasting effects. Stones can break my bones, but words can do me no harm. That's so untrue. So yeah. Thanks again for this forum, Doc, and for Andre giving you space for it.
Yes, thank you for calling.
I continue to listen and I continue to grow.
Yes.
Thanks.
Thank you very much for calling.
Thank you. I'm glad that we are educating persons, because I heard her mention a few things that we've mentioned here. She is learning from the program, so that's very good.
And she's also very brave. She said that she's one of your patients.
Yeah, I know her.
Yeah, and I mean, I'm saying that because I went back. I'm thinking of what you said earlier, the whole stigma issue. So she's really, really a brave lady.
Yes, I mean, she is a brave lady. I mean, outside of just calling her, she is a brave lady who's made tremendous strides in her treatment, and who's come a long way. So even some persons accusing her of being crazy, I mean, it's just so sad.
Yes,
like persons with a lot of energy and vibrance who can enrich anybody's life that they're involved in, but then the person's not understanding what's happening and accusing her of being crazy.
And this is something that we do without even thinking. We do it with females, we do it with males. Up to yesterday, somebody called the program and they were using, saying somebody's mad, and I had to say to the person, that we're not supposed to be saying those things.
It's derogatory. I mean, I have a rule in my office. Those words are not allowed in my office. So anybody who comes up with those words, they retract them, because they're very judgmental and derogatory. Yeah? I actually forgot what the first caller had asked me.
Oh, he was talking about if it's possible somebody can have an episode.
Yes. So yes.
On the spur of the moment kind of thing.
Because you see, we tend to underestimate the effect of stress on ourselves. And just by going through adverse life experiences, especially as children, and having to suppress those experiences, that in itself is a source of significant stress, because we grow up in survival mode. So we cannot thrive, because we're always hyper-vigilant. We're always looking for a threat. We always think something bad is going to happen. We what people call overthink things. And that is because we're in survival mode. And just being in survival mode is like walking on a tightrope. So at any moment you can fall. So we have to know what our antecedents are, and that's the reason for this program. Know where we came from, what we went through, where we at now. It's like doing a SWOT analysis. Where we at now, and how can we move forward to thrive, and how can we stop surviving as human beings. So if we don't understand all of those things in the past, then we can't know how to learn to thrive.
Mm-hmm.
Yeah. And St. Lucia, I mean, like many of the Caribbean islands, we continue to struggle with limited resources in mental health. We have a small number of psychiatrists. I mean, a couple of years ago, I used to tell everybody I feel like a boat on a lonely sea, because everybody was coming to me and everybody was me and reaching out to, everybody wants me to do something. We even have a small number of psychologists for the population. So yes, we have psychologists, but a small number. I mean, half of the psychologists or more here, I myself don't even know who they are. So when I have to refer persons, I have like 3 or 4 persons that I refer to. And I'm sure there are at least 20 psychologists in St. Lucia. So I don't know. We have a dearth of social workers. How many social workers do we have who are not in the public service? Yeah. So we do have a growing population and limited number of human resources that to serve that population. Our community clinics, how much privacy do the clients have there? How quickly does somebody move from referral to seeing a specialist? Another gap is in integration. Even it's still seen, mental health is still seen as a separate part of healthcare. Mental health is part of healthcare because, I'm not sure who said it, but there's no health without mental health. You cannot, because the brain controls every aspect of your body. And stress in itself is a significant precursor of so many physical illnesses, from autoimmune diseases to heart disease. Yeah? So we need to stop thinking of mental health as separate to health, to general health. I always hear people talking about we're having a health fair here or health fair there. And is there any mental health screening? Is there anybody to talk about mental health? No.
Yeah, most times, no.
Come and check your pressure and your sugar.
Mm-hmm. Yes.
Yeah? What causes blood pressure? Most times stress. Yeah? So and then we have the stigma, like the caller was speaking about. Somebody tries to speak to a family member or loved one about their mental health struggles, and they're called crazy, or they're called weak, or they get over it, it's only in your head. You know? And then there's the aspect of policy. Things happen too slowly in St. Lucia. So we put forward a mental health policy, or even a mental health act. I think there's a mental health act, which is a reviewed act, sitting somewhere since 2010 or something like that, or 2012. And it's not been put into practice. Still in draft. So the policies, the policy implementation is slow. And that, I guess, due to funding and training gaps. And not just training gaps, but even training bias. So how many doctors do we have here? Lots of young doctors. And how many of them want to do psychiatry?
We have another call.
Yes. Good morning, caller.
Good morning.
Thanks for calling.
I would like to find out about, like, women when you're going through menopause and you feel depressed, you feel like you want to scream, you want to cry. Many things come to mind. Is that like a mental issue?
I won't call it a mental issue. I mean, menopause is yes a physical issue, which does have its mental health repercussions. Because what happens with women is that you have a significant decrease in the hormonal levels, especially estrogen levels. And estrogen, a lot of people don't know, but is a buffer for so many chemicals and hormones that have to do with our mental health. I mean,
is there any treatment?
Well, you would need to speak to your gynecologist, because I know there is hormonal replacement therapy that a lot of the gynecologists suggest for persons who have significant difficulty when the perimenopause period arrives. So speak to your gynecologist, and if your gynecologist feels that in addition to the hormone replacement, you may need to see a mental health professional, maybe some other antidepressant or something may help, then they can refer you. But I think the initial person to speak to would be a gynecologist who would be able to adequately advise you.
Okay, thank you.
You're welcome. I'm sorry to hear that you're going through that.
That was a very good question, actually.
Yes. So amid all of the challenges that we have, we do have progress. So I do know of a few NGOs that have come up in St. Lucia. I think Raise Your Voice is one of them. There are a few for vulnerable children and girls. And we have churches taking a more active role in the mental health of their congregations. And I'm hearing less talk about it's a spiritual thing and just pray about it. And I'm hearing more talk about you need to get mental health care, especially from the churches. And I like that. So you have schools as well getting more involved. Yes, there's a lot of pushback because some principals or ministry officials believe that incorporating mental health education into the school system may take away from the other kind of education that persons need. But I do see some progress happening. I know that we have school counselors. As far as I know, school counselors cannot give the kind of counseling that I would love them to give, because they're more like guidance counselors. And when they have children with significant mental health issues like depression and anxiety that is outside of their purview, they can't treat because they're not allowed to. So they would have to refer to the wellness center or another clinician who can assist. So, but that is something that I guess that will progress with time. So I guess we have to just be patient with what's being done in the ministries.
Let me just remind our listeners that we have about 10 minutes to go. And the numbers, if you wish to call, the fixed line is 572-9710, 572-9710, or you can call the WhatsApp platform at 287-0971. WhatsApp is 287-0971. You're listening to and viewing Mind Matters with Dr. Julius Gilead. Yes, back to you, Dr. Gilead.
Yes. So what is missing is basically a fully Caribbean model, something that is ours and not something that we've borrowed from the US or Europe. Because we are a unique people. Yeah, look at how our culture is making waves around the world. Our Caribbean culture. So it started with Jamaica, and then all the other countries, the culture is making waves. So how can we have our own Caribbean model of mental health treatment, mental health systems that the other parts of the world can be envious of? I remember when the Cubans came out with the primary care, and everybody in the world was wowing of how the Cubans with so little resources can put this thing together. And it's a very effective system. So how can we as a whole Caribbean region develop a model of mental health care that other nations of the world can be envious of? And I think we can, because we do have a lot of things in our favor. We do have more of a sense of community here in the Caribbean than most of the other countries around the world. I mean, if you go to the US, you don't even know who your neighbor is. You don't even know who the person in the cubicle next to you is at work. And so that sense of alienation in those places, we don't want that to trickle down here. We need to continue to make our communities communal. Yeah? We need to get our children back into playing with other children in the community, get ourselves having meetings with other parents in the community, leaning on each other, learning from each other, because no man is an island and no one person can raise a child or a set of children. It has to be a community thing, because that's where the best outcomes have been historically, and I believe that's where the best outcomes can be in the future. Yeah? So I would really love to know from some more callers what the experience has been like with mental health in St. Lucia, and even with regards to their loved ones. I know some persons, when they do have a loved one experiencing mental health difficulties, they don't know where to turn. And when they think about the wellness center, a sense of dread comes up in them. And that is not supposed to be. It's somewhere like that, like the wellness center. It's supposed to be a place that's welcoming. It's supposed to be a place that's therapeutic, and persons need to know that. So the treatment then needs to be on par with treatment that the persons would receive in the private sector. Not everybody can afford to come to my office. Not everybody can, and that's where the disparity is, Andre. So you have persons who can afford that kind of treatment, getting it, and then you have persons in the lower income bracket who can't afford it, or can maybe come to one visit and then afterwards they say they can't come back, and then they have to be referred to the public health system. And
you have 2 calls. Let's take the first one on the WhatsApp platform, and then we have somebody on the fixed line.
okay, good morning, caller.
Good morning, Andre, and good morning to Dr. Billard.
Good morning to
I
you.
wanted to call in to commend you all on the discussion. Normally it's very good. I listen and I don't really call. But today I found it particularly personal to me because I'm currently pregnant. When he was talking about how social media and the algorithm can sort of affect your mental health, not just in children but also in adults, I identified with that because so often when you go on social media, there's random things will pop up. So even if you assign a certain channel or a certain platform to your child, by the time you blink, something else, some monster, some this, some that, something sexually inappropriate has already popped up, whether it be in an ad or whether it be the next video just automatically loading. So I get a lot of stuff that I have to close. Sometimes you get a lot of things about persons who have had miscarriages, unfortunately, or they have had some sort of issues in their pregnancy, and then I just had to program myself to close that automatically and to just ensure that I am not exposing my mental health to that sort of panic and anxiety, unnecessary anxiety. So I just wanted to say yes. I just wanted to commend y'all on the discussion and to say that y'all are doing a great job. And thank you for the information and the awareness.
Thank you.
Listen, before we go to the next caller, Andrew, just to add to what you said, what we have to understand is that the social media companies, in fact, the apps that we access, their job is to keep us on the app for as long as possible, and they're very unscrupulous, So we have to be aware of what's happening. So the devices listen to what we say in our daily life, and before we know it, we have all of those things coming at us because we had a conversation with somebody about something before, or our child may be experiencing that because we had a conversation about it before. So we have to be very careful about how we have access, the kind of access we have to the different apps on those devices. Good morning, caller.
Hello?
Hi, good morning. Thanks for calling.
Hi. I just wanted to thank you for this show. I wanted to focus on the fact that, or ask a question based on the fact that we were cultured differently and went through some of these unique experiences. I would imagine that it places us in a position to experience mental illness slightly differently. Certain things that we go through may not be the same way as or how do we recognize that it's affecting our mental illness? For instance, when you speak of anxiety and ADHD, I'm assuming that in the meaning of the word or the meaning of the diagnosis as it pertains to ADHD and anxiety, it's the same thing it would be, but because of our experiences, does that show up slightly differently? And are you finding certain things that we go through or our mental illness is slightly different to what is existing around the world, and how do you diagnose us differently?
Yes, definitely, caller. What I like to point out to persons is one of the words that we use in most diagnoses, and that's the word disorder. So I don't like to probe into persons and force them to get treated if what they're experiencing does not cause disorder. So disorder suggests dysfunction in either the social functioning or either their work functioning, or if it's in the case of a child, their school functioning. So if the person does not have this function and they come to me with just symptoms, then we have a conversation around that. So I want to know what it is you intend to achieve by having this conversation if you're not having this function. And most persons say, I just want to treat it before it gets worse. And then we'll have a conversation around why it is you believe it will get worse, and how it is that you so far in the future, if it's not worse now, and why not focus on what's happening now, and how these symptoms may be benefiting you instead of feeling that they're not benefiting you, because anxiety in itself does have benefits. If we're not anxious, then we cannot, most persons give the best that we give. Persons can't rely on us. We feel dissatisfied with what we put out there. We feel that our work is not up to par, and all of those things. So anxiety does have its purpose and its benefits. The thing about it is also has its negative side. So our duty is to, how do we reduce the negative sides while keep as many of the benefits as possible, so that we don't have dysfunction, because the dysfunction comes from the negative aspects of anxiety. Things like ADHD, the same way. Most of the symptoms of ADHD have benefited us, because if we're going through a difficult situation and we don't disconnect, how maybe we may not have done as well as we are doing now. So that habit of disconnecting is something that then pervades the other aspects of our lives. But at some point in our life, it was necessary. Yeah.
Okay, we have to wrap up. Dr. Gilead?
Yes.
It's already time.
Okay, Andre, so as we close, what I want to persons to remember is that mental health is not just an individual issue, it's a community responsibility. The Caribbean mind, and indeed the St. Lucian mind, has survived centuries of hardship, slavery, poverty, storms, displacement, yet we remain pretty resilient. I think resilience was one of the things that was your program before, no?
Oh, yes.
Yes. So the resilience is our power, that resilience. And let's just not use it not just to survive, but to thrive. Yeah? And by building mental health systems that understand our stories, our strengths, and our struggles, we can do that. So thanks everybody for listening to Mind Matters. And remember, to care for your mind is to care for your life.
And let's also remember today, Dr. Gilead, that we should not be calling people mad.
Yes, or crazy.
Right. Let's try to remove that like from our vocabulary. Right. It is highly disrespectful. Okay. Let's have a zero tolerance toward that. Those phrases.
Yes. So not just that, Andre, but when we develop mental health issues or have difficulties, then we start to tell ourselves those kinds of stories, and it doesn't help with dealing with what we're dealing with.
Yes.
So thanks for having me again, Andre, and thanks for listening.
And thank you very much, Dr. Gilead. And as you can hear from the callers, people are very pleased with the work that you're doing.
Thank you, and it will continue.
Thank you very much. Okay, this has been Mind Matters with Dr. Julius Gilead. Listen again next week, Wednesday, same time from 10 o'clock for another Mind Matters. Well, this is the end of my stint here on Rev-Up for today, Wednesday, the 15th of October. Thanks for listening and thanks for viewing. We have Kina. She's coming on next. She'll be with you until 3 this afternoon. From 3 until 5, Send the DJ will be in the house. Then from 5 until 6 is going to be Powell Politic with Mary Polius. So do have yourself a great Wednesday. Andre Paul saying so long.